You rolled out of bed this morning and your body felt like it had been filled with concrete overnight. Your knees screamed before your feet even hit the floor. Your hips locked up like a rusted gate. Your fingers were so swollen and stiff, it took you 3 full minutes just to grip your toothbrush. And here is the part that should make your blood boil. You did everything right. You took your ibuprofen. You swallowed your turmeric capsules. You stretched. You watched what you ate. And yet you are still standing in your bathroom at 6 in the morning, gripping the sink with both hands, waiting for the wave of pain to pass so you can begin the exhausting process of simply existing in your own body for another day. If that is you, I need you to stop whatever you are doing right now and watch every second of this video. Because what I am about to tell you will not just change how you manage pain, it will permanently change how you understand what is happening inside your body at the cellular level, and why every single thing the mainstream medical industry has told you to do is making your biological crisis dramatically worse with every passing day. I am going to expose a biological mechanism that your doctor has almost certainly never explained to you. It has a name. It is well documented in peer-reviewed science. And it is the real reason your pain never fully goes away no matter what you take. Then I am going to give you an exact protocol using a cutting-edge class of molecules that the pharmaceutical industry has absolutely no financial interest in you ever discovering, because these molecules do not just mask your pain. They command your own immune system to stop the destruction, clean up the wreckage, and rebuild what has been damaged. This is not hopeful language. This is molecular biology. Stay with me, because we are going to cover a lot of ground, and every single piece of it matters. Let us start with what is actually happening inside your body right now, because the story you have been told about joint pain and aging is dangerously incomplete. For most of human history, inflammation was one of the most powerful survival tools your body possessed. When you twisted your ankle or cut your hand or fought off a bacterial infection, your immune system would launch a precise and controlled inflammatory response. Think of it exactly like a fire alarm system in a building. The moment the alarm detects smoke, it triggers a cascade. The sprinklers turn on, the fire department arrives, the crew extinguishes the flames, assesses the damage, and begins the repair process. Then, crucially, when the job is done, the alarm shuts off. The fire trucks leave, the building returns to normal, the system resets itself and waits quietly for the next emergency. That is how inflammation is supposed to work. It is a temporary, targeted, self-limiting emergency response. The key word there is self-limiting. Healthy inflammation has a built-in off switch, a biochemical resolution phase that clears the immune cells from the scene once the threat is neutralized and the tissue repair has begun. Now here is where the story changes after 50. And this is the biological villain you were never warned about. As the human body ages, it progressively loses its ability to produce the specific molecular signals that trigger that resolution phase. The alarm goes off, the fire trucks come, but nobody ever sends the signal to shut the alarm down. The trucks just keep circling, the sirens keep blaring, the hoses keep running. And because your immune cells are receiving a constant emergency signal with no resolution command, they begin doing something catastrophic. They start attacking the surrounding tissue. Your own macrophages, which are the large immune cells designed to consume debris and pathogens, begin consuming your cartilage. Your synovial fluid, the lubricating cushion inside your joints, gets degraded by enzymes that are supposed to clear only damaged tissue but are now operating in a systemically confused, chronically activated state with no off signal to stop them. Scientists have a name for this condition. It is called inflammaging. It is a fusion of the words inflammation and aging, and it describes a state of chronic, low-grade, systemic inflammation that becomes biologically locked into the aging body. It is not the same as the acute inflammation from an injury. It is quieter, more diffuse, and far more destructive over time because it never stops. It does not spike and resolve. It simply persists, grinding away at your cartilage, your connective tissue, your vascular walls, and even your mitochondria, the energy-producing organelles inside your cells, 24 hours a day, 7 days a week, 365 days a year. Research published in journals including Nature Medicine and the Journal of Clinical Investigation has documented that adults over 50 show significantly elevated circulating levels of pro inflammatory cytokines, including interleukin 6, TNF alpha, and interleukin 1 beta, even in the complete absence of any active infection or injury. Your immune system is running its emergency protocol continuously, with no legitimate emergency to respond to and no molecular signal capable of telling it to stand down. Two curiosity gaps I promised you, and here is the first one. If inflammaging is so well documented in the scientific literature, why has your doctor never mentioned it? And the second one, if your body once had the ability to naturally shut off inflammation after every injury you ever healed from in your 20s and 30s, why has that ability disappeared and can it be restored? Hold those questions. We are going to answer both of them completely, but first I need to dismantle the two most dangerous pieces of advice you are almost certainly following right now. Let us talk about ibuprofen. Every single day, millions of adults over 50 are reaching into their medicine cabinets and swallowing one, two, sometimes three or four ibuprofen tablets just to get through their morning. It has become so normalized that physicians prescribe it casually, pharmacists recommend it without hesitation, and the entire culture of pain management for older adults is built around it. And I am here to tell you that this is one of the most medically reckless habits in modern healthcare, and the data to support that statement is not subtle. A landmark analysis published in the British Medical Journal and widely replicated in subsequent gastrointestinal research demonstrated that regular NSAID use, which stands for non-steroidal anti-inflammatory drugs, the category that includes ibuprofen, naproxen, and aspirin, increases the risk of serious gastrointestinal bleeding events by over 300% compared to non-users. 300%. That is not a marginal risk. That is a catastrophic elevation in your probability of developing a peptic ulcer, a perforated intestinal wall, or a bleeding event that can require emergency hospitalization. Here is the mechanism so you understand exactly why this happens. Ibuprofen does not selectively target inflammation in your joints. It systemically inhibits an enzyme called cyclooxygenase, specifically COX-1 and COX-2. The problem is that COX-1 is also responsible for producing the prostaglandins that maintain the protective mucus lining of your stomach and small intestine. When you suppress COX-1 with ibuprofen, you are simultaneously stripping away the biological armor that keeps your gastric acid from eating through your gut wall. You are essentially choosing to reduce your pain signal while destroying the tissue that separates your digestive acid from your bloodstream. And here is the most insulting part of this entire equation. Ibuprofen does not resolve inflammation. It temporarily suppresses the signal. The moment it metabolizes out of your system, the cytokine cascade resumes at full intensity. You are not treating anything. You are paying for your pain relief with your intestinal integrity and getting absolutely zero biological resolution in return. Now let us demolish the second great lie of the joint pain industry, generic turmeric powder. The marketing around turmeric has been extraordinarily effective. The supplement industry has generated billions of dollars, convincing adults over 50 that swallowing raw curcumin powder will extinguish their inflammation. And it is almost entirely fiction when we examine what actually happens at the molecular level. Raw curcumin, the active compound in turmeric, has a bioavailability problem so severe it has been extensively documented in pharmacological literature. When you consume standard turmeric powder or a generic curcumin capsule without specialized delivery technology, your stomach acid begins degrading it almost immediately upon ingestion. Studies measuring plasma curcumin levels after oral ingestion of raw curcumin have consistently found that less than 1% of the ingested dose actually reaches systemic circulation in a biologically active form. Less than 1%. The remaining 99+% is broken down, excreted, or never absorbed. You are spending your money on a compound that your digestive system destroys before it ever reaches the tissues that are on fire. Meanwhile, your systemic inflammatory cascade, driven by TNF-alpha and IL-6 and the absent resolution signals we discussed, continues completely uninterrupted. You have been led to believe you are doing something powerful for your biology. You are doing almost nothing while the fire burns. So, if ibuprofen destroys your gut without resolving the inflammation and generic turmeric never reaches the biological sites where it is needed, what does the science actually point to as the real solution? This is where the biology gets extraordinary. And this is the discovery that the pharmaceutical industry has no economic incentive to amplify because it cannot be patented in the same way a synthetic drug can. Your body, when it is young and functioning optimally, produces a class of molecules called Specialized Pro-resolving Mediators. Scientists abbreviate them as SPMs. They are derived from omega 3 fatty acids through a series of enzymatic conversions, and they include several molecular families, including resolvins, protectins, and mersins. These molecules are not anti-inflammatory in the way ibuprofen is anti-inflammatory. That distinction is critically important, and I need you to understand it precisely. Ibuprofen suppresses the initiation of the inflammatory response by blocking an enzyme. SPMs do something categorically different. They are active resolution signals. They physically dock into specific immune cell receptors and issue commands. They tell your macrophages to shift from a pro-inflammatory attack mode into a pro-resolving clearance mode. They instruct your neutrophils, which are the first responder immune cells that flood into an area of inflammation, to stop releasing their destructive enzymes and begin programmed clearance. They trigger a biological cleanup operation that actively removes inflammatory debris, neutralizes the cytokine signals, and initiates tissue repair. This is the biochemical off switch. This is the molecular signal that your aging body has progressively lost the capacity to manufacture in sufficient quantities. The reason your fire trucks never leave is not because your body forgot how to send them. It is because your body forgot how to produce the signal to call them back. Research from the laboratory of Dr. Charles Sirhan at Harvard Medical School, which has been among the most prolific in SPM science over the past 2 decades, has demonstrated that these resolution molecules are not passive, they are active, receptor-mediated commands with precise biological targets. His team coined the term resolution pharmacology to describe the therapeutic paradigm of triggering resolution rather than suppressing initiation. The principle inverts the entire pharmaceutical model. Instead of blocking the start of inflammation, you are commanding the completion of it. Clinical studies examining marine-derived SPM concentrates, produced from cold water fish oils, through specialized molecular concentration processes that preserve the bioactive lipid mediators, have shown measurable reductions in circulating inflammatory markers. Research published in the Journal of Leukocyte Biology documented that supplemental resolvins derived from EPA, one of the primary omega-3 fatty acids in marine oils, could reduce neutrophil recruitment to inflammatory sites by significant margins, while simultaneously enhancing macrophage-mediated clearance of apoptotic cellular debris. A Norwegian clinical trial examining concentrated marine lipid extracts containing SPM precursors in patients with chronic musculoskeletal pain reported statistically significant improvements in pain scores and joint mobility after 12 weeks of supplementation, with researchers noting that the mechanism appeared distinct from conventional anti-inflammatory pathways and consistent with active resolution rather than suppression. This is not fringe science. This is published, peer-reviewed, institutionally credentialed research conducted by some of the most respected immunologists in the world. The reason you have not heard about it is not because it lacks scientific credibility. It is because there is no $20 billion industry built around it yet. Now compare that mechanistic picture to what ibuprofen offers. A temporary COX enzyme block that suppresses your pain signal for 6 hours while destroying your intestinal mucosa and providing zero resolution of the underlying cytokine storm. The contrast is not even close to comparable. Let us add the second pillar of this protocol and explain exactly why it is non-negotiable. Vitamin D3, not vitamin D2, not a fortified food source, specifically cholecalciferol, which is D3 in concentrated supplemental form. Here is the biological reality that most clinicians gloss over entirely. Vitamin D3 operates in the immune system not merely as a nutrient but as a hormonal signaling molecule. Its active form, calcitriol, binds to the vitamin D receptor, or VDR, which is expressed on virtually every immune cell in the human body, including the macrophages and T cells that are central to the inflammaging story. When calcitriol binds to VDR on a macrophage, it modulates the transcription of dozens of genes related to immune activation and cytokine production. Studies measuring vitamin D status in adults over 50 consistently document that the vast majority of this demographic is clinically deficient, with serum 2,5 hydroxyvitamin D levels below the threshold required for optimal immune receptor sensitivity. Research published in the American Journal of Clinical Nutrition found that vitamin D deficiency significantly impairs the resolution phase of immune responses because the VDR-mediated pathway is integral to the macrophage polarization switch that SPMs help trigger. In other words, without adequate D3, the receptors that SPMs dock into are functionally desensitized. The signal cannot be fully received. D3 is not a complement to the SPM protocol. It is the molecular primer that makes the protocol work at full biological capacity. Here is your exact protocol. This is the fire extinguisher protocol, and it is the most targeted anti-inflammaging strategy available to you based on current clinical evidence. Every morning, 30 minutes before your first meal, you will take 1,000 micrograms of concentrated marine-derived SPM complex. This product must specifically list resolvins, protectins, or mycins on the label, or must identify the product as a specialized pro-resolving mediator concentrate derived from cold water marine lipids. Generic fish oil capsules do not qualify. The molecular concentration process required to isolate active SPMs is distinct from standard omega-3 processing. You need SPM concentrate, not standard fish oil. Simultaneously with your SPM dose, you will take 5,000 IU of vitamin D3 in the form of cholecalciferol. Take this with a small amount of fat, even a teaspoon of olive oil or a few nuts, because D3 is a fat-soluble compound and requires dietary fat for optimal intestinal absorption. This is not optional. D3 taken without fat has significantly reduced bioavailability. Take both compounds at the same time, 30 minutes before your first meal, every single day for a minimum of 7 days. The reason for the pre-meal timing is biochemical. In a fasted or near-fasted state, your gastric pH has not yet been fully stimulated by food intake, and the lipid-based SPM concentrate will encounter less digestive enzymatic competition, supporting more complete absorption of the bioactive mediators. During this 7-day period, eliminate NSAIDs entirely. I understand that instruction may feel frightening if you have been dependent on ibuprofen to function. If you have a clinical condition requiring NSAID therapy as prescribed by a physician, consult your physician before making any change. But if you are taking ibuprofen as an over-the-counter habit because your joints hurt and nobody gave you a better option, this protocol is your better option. Every day you continue taking ibuprofen while implementing the SPM protocol, you are simultaneously destroying your gut lining, suppressing the very cyclooxygenase enzymes involved in SPM conversion from their omega-3 precursors, and actively interfering with the resolution cascade you are trying to activate. Add one supporting lifestyle factor during this week. Increase your water intake to a minimum of 2 to 2.5 liters per day. The resolution phase of inflammation, the biological cleanup operation that SPMs command, is a fluid-dependent process. Your lymphatic system, which is responsible for clearing the inflammatory debris that macrophages package for removal, requires adequate hydration to function efficiently. You cannot drive a garbage truck on an empty fuel tank. Hydrate aggressively, and your resolution cascade will operate at higher capacity. Every morning of the 7-day challenge, before you get out of bed, rate your morning stiffness on a simple 1 to 10 scale. Note which joints feel most locked, how long it takes before you feel mobile enough to move comfortably, and whether the systemic achiness that follows you through your mornings begins to recede. Most adults who implement this protocol with full compliance report a noticeable shift in their morning stiffness assessment beginning around day 3 to day 4 as the SPM-mediated resolution signaling begins to accumulate systemic effect. This is your 7-day inflammatory flush challenge. 7 days. Full protocol compliance. SPMs plus D3. 30 minutes pre-meal every morning. NSAIDs eliminated. Hydration maximized. Morning stiffness tracked daily. Now, I want you to do something that feels symbolic but is biologically significant. Take whatever bottle of ibuprofen is sitting in your medicine cabinet and move it out of your daily reach. Put it somewhere inconvenient. You are not throwing away your emergency option. You are breaking the reflexive habit of chemical suppression as your first and only response to pain. You are choosing to activate your biology rather than silence your symptoms. Subscribe to this channel right now, not because I need the numbers, but because what I am going to show you next may be the single most important piece of metabolic information a person over 50 can possess. In the next video, I am going to expose the connection between your gut microbiome and the inflammaging cascade you just learned about, specifically revealing how a specific class of gram-negative bacteria in your intestinal tract is actively leaking a compound called lipopolysaccharide through your intestinal wall directly into your bloodstream, triggering a secondary inflammatory cascade that floods your joints with cytokines around the clock, and why this means that even a perfect SPM protocol will only take you 60% of the way there if your gut barrier is compromised. Hit the notification bell. That video goes live very soon, and the information in it will make everything you learned today even more powerful.